Good afternoon, everyone. I'm Catherine Brookman, Associate Director, Knowledge Transfer and Exchange, and on behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Promotion of Musculoskeletal Disorders, or CRE-MSD as we are more commonly known, we'd like to thank you for joining us today for this free webinar on assessing the effect of a hip flexor stretching program on MSD prevention for performing overhead tasks. We are grateful to the Ministry of Labor, Immigration, Training and Skills Development for our funding, which supports the delivery of these webinars, and to our presenters who provide their expertise. This webinar will be recorded, with the recording being made available to you on our website, along with the presenter's slides shortly after today's webinar. The format of today's webinar is as follows. The presentation will be given, after which time we will have 10 to 15 minutes for a question and answer period with our presenter. During the question and answer period, we ask that you type your questions into the chat box. The chat box can be pulled up on your screen by selecting the chat icon in the control panel that appears near the bottom of your screen. I will relay these questions to the presenter or a similar question should we have duplicate themes. You will be muted for the entire presentation to ensure there is no background noise disruption. Should you have a pressing question or an issue such as a technology glitch that cannot wait until the end of the presentation, please type this into the chat box and we will do our best to address it right away. At the end of the webinar, you will be sent a link to an evaluation. Please fill out this evaluation as it will assist us in the future delivery of our webinars. Thank you so much for joining us today, and if you have not already checked out our redeveloped website for the Ontario MSD Prevention Guideline at msdprevention.com, please do. We have improved the search and resource library functionality, have added an interactive guideline selector, and a new introduction video. Now it is my pleasure to introduce to you our presenter, Graham Mayberry. Graham is a PhD candidate in Dr. Jack Callahan's Spine Biomechanics Research Lab. He received his Master's of Science degree from York University in Kinesiology and Exercise Science. His field of interest is the impacts of stretching and daily living on muscular properties, with a particular focus on hip muscles as they relate to spine kinematics. Chronic back pain led him to pursue a PhD in an attempt to better understand the mechanisms of his own experience and further the understanding of non-specific low back pain using traditional biomechanics tools as well as MR imaging. One of the primary goals of this CRE-MSD funded research that he is speaking about today was to determine the effects of a hip stretching protocol on shoulder angle during overhead work and how one link on the kinematic chain impacts another. By emphasizing the importance of hip flexor mobility, perhaps the inclusion of this stretching intervention will reduce the probability or magnitude of MSD injuries, not just in the spine, but also in other links along the kinematic chain. Now, without further ado, over to you, Graham.
Thank you very much, Catherine. Okay. So it's a pleasure to be here, and I look forward to going through a topic that is near and dear to me. And I hope by the end you'll also be as enthusiastic as I am about this type of work and approach to injury and pain prevention. I'll be starting with a little background on the hazards of overhead work and some of what is out there. It is a well-researched topic. With this time, I understand I'll only be scratching the surface, but it should provide some background on the issue as it pertains to the research. From there, I'll go to the rationale for the study and the lens I use to see this issue, followed by the methodology and the findings, before going through some stretch programs in general and how this research fits in with current literature and musculoskeletal disorder prevention approaches. So when we think of overhead work and the many tasks that require such conditions and postures, I'm sure the first thing that comes to mind is, ouch, that looks pretty painful. And if you have to work in those conditions for an extended period of time, you're probably going to be feeling it, both in the moment and later on. Unfortunately, it's pretty common in many workplaces. So a couple numbers here. So nearly 13% of the 20,000 survey respondents said their job includes frequent overhead demands. This study, as well as countless others, have indicated that there is a doubling of arm and shoulder pain and injuries with overhead demands compared to other work. Muscle fatigue is often cited and experienced by said workers, leading to pain and discomfort as a reason to keep the exposure to a minimum. Furthermore, when the arm is raised above 90 degrees, it can lead to an increased risk of subacromial impingement syndrome and injury to the underlying tissues, notably the rotator cuff, and it really does put the shoulder in a precarious position and stresses the underlying anatomical structures, thus increasing the risk of injury. Needless to say, I think we can all agree that it's not a fun posture to be working in, as it can cause pain and discomfort around the shoulder, not to mention increases our risk of injury. So because of these risks, there's been a lot of research into what we can do to avoid and minimize the potential for injury. For example, the MSD prevention website, which was alluded to and is a really great site to work through now, has a litany of links and tools designed specifically to assess the risks of these postures, with resources on how to quantify them for a given task or environment. The list on the left is of the library of overhead work assessment tools, such as checklists, activity scales, and threshold limit values. Again, these are valuable and available on the MSD prevention page by searching for overhead work. Everything from grip force, type of task, such as pushing and pulling, etc., and the tracking the type of work at various distances and locations is covered. On the right side, we have a nice infographic where you can see what postures are risky for the shoulder during various overhead work and what tasks, exposure time, and direction of forces to avoid. So that's all great, and I think we can all agree that's the first step we should be doing, is to try to adapt the workplace environment and re-engineer space to better avoid and limit the exposure time. As a little aside, I've spent a lot of time over the years doing small renovations, which have included electrical work, which is very fiddly, like that individual working right there, followed by drywalling and sanding the ceiling and then painting. I was trying to think back on how I would have avoided these postures, and I honestly couldn't think of a practical way to do so. I can attest that when I did this work, I definitely felt some of these shoulder-related symptoms, and the fatigue is very real. But mostly, instead of this, I felt a lot of this. While low back pain is often associated with lifting-related work and moving heavy objects, does that not mean it's exclusive to those tasks? Or does not mean it's exclusive to those tasks, nor does it mean we aren't exposing the multiple areas of the body to an elevated risk of injury or pain in a given posture, such as overhead work. I'll take the study by Macmillan et al. In 2015 of the Saskatchewan workers or Saskatchewan farmers who completed a survey inquiring about their injury history. 57% reported low back pain, 44% reported shoulder pain, and 40% reported neck pain over the previous year. So clearly some, and perhaps many, people were experiencing pain in multiple locations. I think we all have done some activity where more than just one area of the body was affected. And if we look at that left picture, the airline picture, that's taken from an article published in the airline maintenance workers during the depainting process, which is just really sanding. They spent between 25 and 46% of the time they were observed standing in that overhead position. The biggest ergonomic risk was not surprisingly the shoulder, with cervical, wrist and hand, and then lumbar making up the majority of the remainder of injuries. So it should come as no surprise that the low back pain is prevalent with this type of work, given that it puts the spine in extension for the duration of the task and is clearly linked to the position of the arms. Whether there's repeated low-level loads on tissues in non-neutral postures or increased force transmission via facet joints, prolonged lumbar extension during overhead working tasks has led to an increase in low back pain and injury reporting. The founding concept for this project is based on the mechanism that if we have some restriction acting on the low back, it will result in altered kinematics and additional stress on the lumbar spine. So as mentioned, while low back pain is most often associated with lifting tasks and compromising postures, such as bending and twisting, it is also reported in occupations where overhead work is required, such as engine mechanics, painters, drywallers, and farmers, to name a few. Overhead work is often associated with neck and shoulder injuries, which has naturally led researchers and economists to focus on intervention strategies targeting the shoulder joint. Reducing workplace MSDs of the neck and shoulder is certainly important. However, that has left the high prevalence of low back pain injury associated with overhead work to be largely ignored. The reason hip flexors were selected here is twofold. One, tight hip flexors can increase pelvic tilt, lumbar lordosis, and limit hip extension, which can impact the spine and result in low back pain. And two, when we raise our hands above our heads, we cause further lumbar extension for a variety of biomechanical reasons. With that in mind, we have a rationale for this research, and the question we were hoping to answer with the study, which is slightly different than I think how I had written it before. So what happens during overhead working tasks if we loosen or stretch our hip flexors? Getting into the research, so the study was conducted at York University with ethics approval and consent acquired. We had 30 participants. They were all healthy with no history of low back pain or shoulder injury that would prevent them participating in the study, and included 14 males and 16 females at an average age of 23 and a half. All participants had been screened for hip extension, and only those with what we defined as quote unquote tight hips or a lack of hip extensibility were included, as this was a part of a larger study, and to ensure that the hip stretching protocol would be appropriate for them. We wouldn't exactly ask a yoga expert or contortionist to do the study, as we wouldn't see much of an impact from a stretching intervention, given their innate flexibility. And to measure this hip extension, if you look on the right, the modified Thomas test was employed, and only those with less than 173.5 degrees of hip angle were included. The image shows someone who is slightly greater than 180 degrees, so it would be a 185 degree hip extension, but it does illustrate the method and the measurement. The average height was 172 centimeters, average weight 77, and then average weekly activity was 5.1 hours. So overall, a pretty typical population, and healthy and healthy. Okay, moving on to the method section. So OpTrack is used to collect kinematic data and generate joint angles with marker clusters, seen here on the left, placed on the shank, thigh, pelvis, T12, C7, head, and upper arms in order to generate the desired joint angles. A custom overhead workstation was built for this project and attached to an overhead beam. The apparatus could be easily raised and lowered down a thread rod and locked into place with a large nut. The working height was calculated based on previous literature, where you take a measure from the greater trochanter to the floor, and then one from the greater trochanter to the hands while their arms are extended. And we could define the working height as 70% of the GT to hands and plus GT to floor. So that way we could normalize across participants. Switching between tasks was easy. You just simply loosen the bolt, rotate the apparatus, and then tighten the bolt again. And the workstation was always adjusted to be perpendicular to the participant, so they were consistently working on a flat surface. So we had a couple tasks here. So the bolt task is how I called it. As you can see, there are 3 sets of bolts on the working surface that were equally spaced. Participants were instructed to move 2 nuts, one on the left and one on the right, from the middle bolt, then down to the bottom bolt, and then to the top bolt, and then continue through this order until the end of the trial. If a nut was dropped, there was an extra one behind each bolt, so they could continue on uninterrupted. As they moved from one bolt to the next, they were to thread the nut all the way to the base and then back off before moving to the next bolt. And this task was performed with both hands at the same time at a comfortable pace, moving them along simultaneously. This task was designed to simulate a fine motor task, such as electrical work, but without the dangers of being electrocuted. For the simulated sanding task, participants were directed to sand as they normally would in a circular pattern, or if they hadn't sanded in the past, it was demonstrated to them. They were instructed to ensure they sanded the entire surface and continually move around the whole surface, reaching all the corners. Tape was used to cover the standing block to prevent sawdust from falling on the participant and irritating their eyes. And by the end, it was a very smooth surface. So the collective protocol, after participants were instrumented and anthropometric measurements were taken, they performed the standard reference tasks such as quiet standing, which was used as a baseline for calculations. They then performed 2 bolts and 2 standing trials, going back and forth and taking a rest in between each trial. Bolt trials were 60 seconds in length, while the standing trial was 90 seconds, with the participant performing 30 seconds with the left hand, followed by 30 seconds with right hand standing, and then finishing with 30 seconds with both hands holding the standing block. Lab stretching was then conducted with an emphasis on targeting the hip flexor that can be seen on the right, i.e. namely the psoas and iliacus muscle complex. So this is shown in the picture, and participants were instructed to keep their spine in an upright posture and not to lean or bend forward at the hip. Specifically, their specific direction was given to isolate the hips by stressing the importance of preventing anterior pelvic rotation. They were standing on a wooden platform with a rail to hold onto for support, with the other leg bent at the knee and resting on a platform on a frictionless jig. With a strap fastened around the thigh, I slowly pulled back on the strap with a pull stick until they felt a good, comfortable stretch, like something that they were feeling tightness or a sensation of stretching, but before it became intolerable or painful. And a transducer was placed in line between the thigh strap and the pull stick to measure the pull force. Once a comfortable stretch was reached, it was held there for 30 seconds before releasing, and this was repeated 3 times on each leg. So for the first session, the participants then performed 2 sets of bolts and standing trials, following that stretching. So just to recap, the first session consisted of the overhead tasks, then stretching, then another set of overhead tasks, while the second session was just a set of overhead tasks and then the stretching. So this gave us a baseline, the immediate effects of stretching, and then post 1 month long stretching intervention. Speaking of which, so between each lab visit, the participants were asked to complete the hip stretching exercises as shown above. So a split leg lunge stretch with the arm raised on the same side of the stretch. Raising this arm helps to lengthen the spine and has been shown to provide a more effective stretch. So prior to leaving the lab, I requested that they demonstrate the stretch to ensure they knew how to accurately perform it. They were given a log sheet with instructions, again, to how to perform it as a reminder, and such as keeping your back straight, align your hips, knees, and shoulders in the forward direction. They were also requested to stretch around 4 to 5 times a week, 3 times a day for that same amount of time, 3 times 30 seconds on each leg, and holding the stretch for a full 30 seconds. So this would result in less than 10 minutes maximum of stretching per day, as each block would take only around 3 minutes. I emphasized to them that it was important not to skip more than 1 day between stretching in order to maximize the benefits. So if they went every other day, that would be acceptable. Take it 4 times a week, but frequency was important here. And I checked in each week to see how they were doing and asked if they needed any clarification with the stretches of the log sheet. I did, however, wonder what compliance would be like, as I know it can be poor in these types of interventions, but I must say I was pleasantly surprised. So I've done a decent amount of research now and found that it's not every study you get people to comply with the request. Previously, I had people wear an activity monitor, and some of them only wore it for 2 days. So this was a considerably better compliance rate. So for this study, I'd like to give participants a lot of credit, as they were great and compliance was very good in my opinion, as we can see from the results. There was some variation, as I say, some people stretched every single day, the full amount, and some a little bit less. But based on my conversations and the instructions to just write down what they did, no pressure, but emphasis on the importance of being diligent about it. I was fairly confident they were telling the truth. I think that the minimal time commitment was also a huge factor, and that they could incorporate it into their daily routine fairly easily. They're at the gym, you could add that to your stretching part there, and just, you know, once in the morning when you wake up and once before bed would basically get you there. So these values represent the averages for the participants as calculated from the stretch logs over the month. Say it was up to 5 weeks, depending on the scheduling, but for the most part, it was around 30 days between visits. No one was above 35 days, and no one was below 28 days. Excuse me, sorry. And so the stretch days per week was on average of 5.6. So some people stretch every day, some closer to 4, but most are around 5 or 6. Total stretch days in that between period was 25.6 days of stretching. Total stretches were nearly 62, and then gave us an average stretches per day of 2.4. And those would be the stretching blocks. So one would be 3 or sets of 3 stretching. So this was encouraging and noteworthy, as I'm not sure how much I would trust for the results, if not for good compliance. So again, big thanks to all the participants who were part of the study. So now on to the results of the in-lab protocol. So we're going to start with the shoulder. So for reference, the 0 would be with your arm at the side, and 180 degrees would be if your arm are straight up. So this is in the anterior posterior plane. On these graphs, we have the shoulder results for the bolt trials and both hands standing portion of the simulated standing trials. The left and right shoulders were averaged together for the bolts and the both-handed standing conditions, with the means shown on the left, while the shoulder-specific results for the left-handed standing and the right-handed standing were on the right. The first measure, or bar, is the baseline set trials, so prior to any stretching, and then the middle one would be the second measure, or the middle bar, on each graph, and the second one represents the follow-up after 1 month of stretching. So as we can see, there was practically no change and no significant difference, between the visits, which was kind of expected, and demonstrated that they were in the same working posture between trials and days. There might have been a slight change in some of the joint angle that I can discuss later on, but for the most part, I think it demonstrates that from 0 arm by your side to that working position, it was pretty consistent, very consistent between trials and between days. So for the bolts and the both-handed standing, all trials were around 125 degrees on average, with minimal change between shoulder angle between task. So around 124 to 126 for the bolts, and 127 to 129 for the standing. For the left shoulder, it was around 129 to 130, and the right shoulder, again, 129 to 131 for that right shoulder. So on these graphs, we have the hip results for the bolts trials and both hands standing portion of the simulated standing task. As for the shoulder, left and right hips were averaged together for the bolts and standing with both hands conditions, and they can be seen on the left of the slide. While the hip specific, hips lateral side results for the left stand and the right stand are on the right side of the screen. So for the right hand, that graph shows the right hip, and then for the left hand, that shows the left hip. Again, same conditions are laid out on the x-axis. So the first bar is baseline, then post immediate stretch, and then post a month of stretching. And on the y-axis, we have that hip joint angle. It's important to note here that a positive value represents the hip is in flexion compared to the quiet standing trial. So this is all relative to that initial quiet standing. If it is 0, then it would be the exact same as quiet standing. And if it's negative, it would mean the hip is in extension compared to that same trial. And if it's positive, they're in flexion. So no statistically significant differences were found in any of these tasks between the time points, but there clearly is a trend here. The p-values for the left and the right hips between the first and the third, so the baseline and then the 1 month stretching, were 0.18 for the left hip and 0.31 for the right hip. So again, there may not be statistical significance found, but there's a clear trend that with the hip stretching intervention, there is an overall reduction in hip flexion and a trend towards adopting a neutral or upright stance during these overhead tasks. Again, here's this showing the trend that we see exhibited on all trials. And finally, the lumbar spine. So on these graphs, we have lumbar spine results for the bolts and simulated standing trials. Again, the mean lumbar angle for the bolts and the sanding with both hands on the left, while the left-handed and right-handed sands are on the right side slide. The bars are representative the same, with OT1, OT2, OT3 being the 3 time points of pre and post stretching on visit 1, and then post 1 month of stretching. On the y-axis, we have the lumbar spine angle. Again, it's important that to note that 0 would be quiet standing. Negative would be you're in more lumbar flexion, so more lordosis, and a positive would be you're more upright compared to that quiet standing trial. So no statistical difference was found between the 2 sets of overhead tasks on the first visit, but when we compare between the baseline and the second visit, we do see some differences. So bolts were quite close to significant. It was at 0.06. The sanding with both hands was P equals 0.02. Sanding with the left was 0.007, and then the right 0.014. So all showed significant differences between the two as they moved from a more lordosis angle to a more upright back angle. So while there wasn't a significant difference in the bolt task, it was very close. It exhibited the same trend between visits. The trend is more pronounced and significant in the sanding tasks, with the greatest difference in the single-handed sanding. I think that has to do with the type of work and the force required to do that kind of work, as well as the hand must get closer to the board than with the bolts task, where they're just using their fingers for the more fine motor task. So it's more of just a typical upright standing with the arms raised in the bolts task. So despite there not being a statistical difference between the tasks on the first visit, stretching may have an immediate effect on the lumbar spine angle, as there was a reduction in lumbar extension within the first day between trials after just one set of hip stretches. But obviously the most pronounced was after a full month-long stretching intervention. Okay, so a quick summary so far. So no change in shoulder angle during the overhead tasks over time. Slightly lower angle during bolts and slightly higher than the hands. No statistical difference between the hip angle pre and post, though there was a trend of a decreased flexion over time or an increase in extension. Statistical difference in lumbar angle between baseline and post 1 month stretching intervention for the lumbar spine, with lumbar extension decreased towards a neutral stance posture with the stretching. Additionally, while I didn't show the graphs for it in the advent of saving time, thoracic and cervical angles were also measured and calculated. There was absolutely no change in the cervical angle across these conditions, so all in fact were within a degree of each other. And there was no statistical difference in thoracic angle, though it did appear there was slightly more flexion of the thoracic spine between the first and the third visits, which would indicate a slightly smaller shoulder joint angle when we specifically look at that the joint. So if the thorax is moving back and the arm is at the same position relative to vertical, then there would be a slight reduction there as well, but not a huge and meaningful number. Okay, so let's take a closer look at the intervention now. So the top graph is the pull force, while the bottom graph is the hip angle. And the left hip is on the left side, the right hip is on the right side, with V1 indicating visit 1 and V2 indicating visit 2. And just a reminder, there was only one stretching set for each, so there's only one V1 and one V2. A more negative value for a stretch angle represents a greater degree of hip extension from that neutral upright standing. No statistically significant difference was found between visits for the pull force for either side of the hips, but there was a notable reduction between visits. It was approaching statistical difference with p-values of 0.3 and 0.1, so over time we might show something. Also, no difference in hip extension for the left side between visits. There was, however, a small difference in the right hip between visits, with participants exhibiting a slightly greater amount of hip extension in the second visit, which really just put it in line with the left hip. So while the differences weren't statistically significant, I do believe this is playing a role in why we saw the change in the lumbar angle between visits. I'd like you to focus on the pull force changes, as that means it required less force to get those stretch angles or those hip angles. Meaning the passive tension has changed for these muscles at these muscle lengths and joint angles, suggesting the muscles adapted or responded to the stretching in a meaningful way. So I'd like to delve a little bit deeper into the hip flexors and why they were the focus of this study. So to recap from before, hip flexors are not only powerful hip flexors, as the name implies, they're also very powerful trunk flexors and influence hip and spine movements in both sitting and standing postures. When I'm referring to the hip flexors, I'm primarily talking about the psoas and iliacus muscle complex. While they are in fact two muscles and share a common insertion point on the femur and similar action, the psoas is the only one of the two that acts to flex the trunk, given its attachment to the anterior aspect of the transverse process of the lumbar spine. Flex trunk, I mean pull it forward. So a few physiological facts about the psoas that make it unique and important. It has a large cross-sectional area. Both active and passive tension are a function of cross-sectional area, and this makes it rather important. And for those fiber type enthusiasts out there, the psoas is dominated by type 1 muscle fibers, which are thought to be inherently stiffer than type 2 muscle fibers. And mechanically speaking, the psoas line of action will pull the spine forward and down, while the iliacus line action pulls the pelvis forward and down, or anteriorly tilting it. These two actions lead to anterior tilt and lumbar lordosis. They help maintain that nice lumbar curve that is important during healthy loading of the spine. However, if they're tighter and potentially shorter than they should be, then we could see an exaggeration of these postures. That's shown here. This in turn could lead to an increase in compressive forces of the spine and lead to low back pain. So how does this affect overhead work? Well, when we raise our arms and extend above our head, we get an increase in lumbar lordosis for a variety of reasons. So the thoracic spine extension can lead to lumbar lordosis extension, as the two are connected and moving one will impact the other. And latissimus dorsi muscles, if they're tight, it would mean that the lumbar spine has to extend to compensate for that. Or perhaps 3, because of poor core stability, which can lead to an increase in pelvic tilt and lumbar lordosis. So when we combine the effects of both upper extremity position and that of tight hip flexors, it can lead to a scenario where they're both causing lumbar lordosis and/or anterior pelvic tilt to compensate for this new position, which could potentially lead to an increase in back pain, which people may be experiencing. So while stretching our latissimus will certainly help, raising our arms above our head will contribute to increased lumbar extension almost no matter what. So on the other side of the equation, we could help reduce excessive lordosis and anterior pelvic tilt by reducing the impact of the hip flexors that they have on the spine. So if we can affect here, then we should be able to affect the biomechanics of the spine during this posture. So let's revisit the results of the study. So using the reduction in pull force to achieve the same or greater hip angle, we were able to demonstrate that a reduction in hip flexor tension through a stretching intervention does indeed have an impact on the lumbar spine during overhead work tasks. For the hips, we see that there is a progression to a normal upright stance posture while working overhead. If hip flexors are longer and more flexible, then this is to be expected, as they should stand more upright without having that pull force during that neutral upright standing. As we can see from revisiting the standing task with both hands, there was a reduction in lumbar extension and hip flexion back towards neutral. So opposite directions in the graphs here. So again, for the lumbar spine, we go back positive, then we're going from more of a lordosis to a neutral or slight forward flexion or more straight back. And for the hips, as we decrease, we're going back to closer to an upright stance, or if we got below that, we'd have an extended posture. But given the position of the work, that would be a little bit surprising. So by reducing this additional force on the lumbar spine at this hip position, which is close to 180 degrees, then we can allow for additional mobility when we add that additional force by raising our hands above our head. Again, a quick reminder that these participants had tighter than average hip flexors to begin with, though they hadn't reported any back injury or sustained low back pain and were otherwise healthy. But given the state of inflexibility in the population, they might represent a decent proportion of the population. as they did represent nearly 25 to 30% of the overall participants I screened. And for the screening, it was just anyone who is healthy and didn't have an injury could come in. So they represented let's say 25 to 30% of that population. With hip flexibility seeming to decline over time and more recently across the population for a variety of reasons, it might be worthwhile implementing this kind of stretching into our lives, as it can have an impact across a variety of activities, particularly those working in jobs requiring overhead tasks to be performed. So what now? So I want to go over a nice review titled "Do Stretching Programs Prevent Work-Related MSDs" by Choi and Willett in 2010, and the citation is at the bottom of the slide. So here are some of the findings they had of the various stretching programs. So stretching at a computer desk. So it was an upper limb stretching of the forearms, and the results were self-reported less pain, but stretching alone could not be identified as a single method of preventing upper extremity disorders for people who work at computer stations. And there's another one that was looking at stretching at manufacturing work. So they used the sit and reach test, bilateral body, and shoulder rotation measurements. And there was a pretty intense regimen of 5 to 8 minutes of stretching 5 times per day. There was no control group for this study, but they were unsurprisingly more flexible by the end of it. And next one, there was a look into stretching at heavy work. So this was a meta-analysis of 5 other studies, and 2 of the studies revealed that stretching, quote unquote, only decreased the risk of injury by 5%, which is not significant. I'm not sure whether, I don't know what maybe not worth the cost of the time, but 5% could be meaningful. There's another study looking at firefighters, and they found that comparing a stretching group to a non-stretching group, the stretching group had 48 injuries over that 2-year period, while the non-stretching group had 52. Doesn't sound like a lot, but what was notable was the cost of injuries. In the stretched group, the cost was $85,000, while in the non-stretched group, it was $235,000. So huge difference here, but again, we don't know the nature of the injuries to properly comment and whether they can be legitimately compared. And we had some stretching at construction work. So endurance was affected by stretching more than strength, and suggested it had more to do with warming up the muscles. A shoulder-specific intervention found that the stretch group showed significantly greater improvements in shoulder rating questionnaire score and shoulder satisfaction compared to the control group. Moreover, pain and disability were significantly lower in the intervention group. So after all that, the authors concluded that while majority of literature reviewed in this study may not fully explain that stretching at work will prevent work-related MSK injuries, some studies have shown that these exercises can contribute to reducing discomfort and pain, and improvements in flexibility, range of motion, and subjective satisfaction scores. Despite the positive inclination towards the benefits of stretching, it is still contentious to reach a definite response about the effectiveness of stretching to prevent work-related MSDs and injuries. So do they work? I think they can. We obviously need to continue to do more research on it, but they need to be applied selectively and with careful consideration. Some of the main issues with stretching programs are compliance, time, and effectiveness. So for compliance, some studies have shown that there's quite low compliance, between 25 and 40%, which may be why there isn't a whole lot of research out there to show their effectiveness. If people are participating, you wouldn't expect much of a change. I think in order to address this problem, constant reminders, effective teaching of proper technique, and a thorough understanding of the benefits are required. Also, incentives typically work, but not in isolation, and they need to have the knowledge and understanding first. And second was time and psychological barrier. So creating time during the workday to make this happen may be the only way to get people to start the program if it is believed to be beneficial only for work. The effects will obviously be felt throughout their life, but if it's viewed as a work problem, then someone may feel like it should be done on work time. Making time for the program starts with scheduling, which can often already be too busy. And the time of the intervention itself, I think, is important. If it's too complicated or there are too many exercises and it takes too long, then it most likely would not be complied with, and dropout is probably going to occur. I find this similar to a lot of physio programs, unfortunately, as they are demonstrated to be effective, but I know too many people that don't do their exercises because there are too many or they're too complicated. So instead of doing them at all, they just stop entirely and only do them at appointments. And finally, effectiveness. need to remember that it takes time for muscles to adapt. So setting expectations is important here. It takes honestly weeks or months for muscles to adapt and to notice a change, whether you're building them up or stretching them or tightening them. The effects of the change on the specific task or posture will likely not be immediate. There may be some short-term benefit, as we sort of saw here, which is great, but the research has clearly shown that these effects from stretching do go away within an hour. Repeated bouts of stretching over a period of weeks will show lasting results that may impact a worker throughout the whole day. The immediate relief should be seen as a positive sign that this type of approach may help, but it will not last for a long time. So I think making sure the expectations are appropriate. And finally, most problems are not solved with just one intervention. Cannot solely solve a problem and eliminate all injury risk, but it might at least help and could and should be used with other interventions. Just a little bit of time left, so I'll just kind of scroll through a few quick stretching programs as example. So this is from the OHS website. So they kind of go through the pros and cons and key elements to consider when implementing a successful stretching program. So check the website out for if you're curious about it. And there's leadership buy-in and support. Again, kind of what I mentioned before, task-focused stretch program. And if it's in a workplace, then supervisor acceptance and reinforcement in order to ensure people are involved in it. Here's an example of one taken off the University of Vermont's website. Looks like they contracted it out to Hellman Associates. So in the introduction, they state that it should only take 5 to 10 minutes a day, should be a light stretch, and are designed to target muscles that are commonly associated with sprains and strains. They state that tightness of muscles increase the risk of injury. That's especially noticeable in the low back region. Tightness of the upper back, lower back, hamstrings, and calves increase the risk of pain and injury to the spine. Some of the things I like, they're practicing safety, a lot of hard hats and reflective vests, and I can only assume steel-toed boots. Some of the exercises do seem useful, and it's nice to warm up the muscles, and probably it will have an impact on reducing some injuries and hopefully improve their well-being overall. We just don't know what they're targeting in terms of the type of work, so it may be a little difficult to get buy-in. But I do like that they suggest to keep it short and simple. CCOH is a huge range of resources, and it was relatively easy to navigate as well. So search through the libraries to find something on shoulders or overhead work or low back pain, or even stretching. Here's what I found. So there are resources on back injury prevention, which focus almost exclusively on lifting and materials handling. So from where to lift, what to avoid, temperatures to work in, pace of work, and so on. For the shoulders, I couldn't find anything specific, nor could I find anything pertaining to overhead work environments, save for safe overhead crane operation. And as for stretching, it was a bit tricky here. Upon first glance, I thought they only had one resource titled Office Ergonomics Stretching at the Workstation, shown here on the right. Here they discuss why it's important and offer some exercises for various reasons of the body you can do while sitting at your workstation. Again, I'm not sure how effective all these were, but it's useful that they were, there are some resources out there to get people started, which is great. And if you search enough resources under health promotion and wellness, psychosocial section, there are 2 resources available, which are exercises for the healthy back and exercises for a healthy back advanced. In the original, there are 4 exercises with some variations. And in the advanced, there are a total of 13 exercises. And in this resources, exercises are not only for the back, but also for the hips, knees, neck, based on the concept of sparing the back. So these are great exercises. I'm definitely not taking anything away from them, but they aren't exactly stretching. And they won't have the same effects of stretching. As mentioned earlier, doing a combination of these things is important to be most effective at preventing injury. The one picture that's closest you can see to target the hips, but it's more of a lunge and only was held for 10 seconds. So it seems to be more focused on the quads and the hips. But I do love to see this, and more of that a little bit longer would provide some greater benefits. The one thing I noted is that these are all published in 2006, so maybe it's time or appropriate so we could implement some new research into there. And I guess the other thing, for most of the stretching related stuff, it is all targeted to office working conditions, which which is great because you're sitting there all the time. But I think we could be missing some people here. So I'm going to slightly pivot here for the last couple slides. As the stretching resources are pretty scarce overall, but I think it points to another opportunity and aspect of the research that I thought was important. So looking through the MSD prevention website, when it comes to the spine, two general themes emerge: office work, so computer station, workstation hazard ID tools, stability balls, etc. Lifting or manual materials handling, so keep it close, draw off the floor, vibration effect, reducing low back pain, disability in mining, etc. Unfortunately, there wasn't a lot of overlap between overhead work that focuses solely on the shoulder and materials handling that discusses the risk to the spine. When you look at the MSD hazard identification tool, we can see the awkward postures for the back is primarily focused on bending, so forward, backward, sideways, and twisting. Again, I really love these tools as they present a clear guideline for assessing work and encourage us to think about so many aspects of a job. I do wonder if they could be tweaked a little bit as they're currently constructed in a very joint specific way with little overlap. But again, I'm really expert on how to do this, so I might just be looking at it incorrectly. So I'd love some feedback on that. But the back and shoulders are not connected here, which might lead one to think of overhead tasks as only a shoulder problem, or lifting in different spine postures as only a back problem. So I'm certain some people experience some discomfort in other areas at awkward postures that may not be represented here, and we might be failing to identify some of the risks of various tasks, such as overhead work. I'm sure you've noticed, not an ergonomist, nor do I have any training in workplace design. Admittedly, you're all more qualified than I am at tackling workplace health and safety issues, but I do like problems, and most of us, and I see how things are connected. So how do these links in the kinetic chain impact one another? If I pull more here, then it'll cause this, which will cause that, and so on. But also like think on the flip side, if I can relieve a bit of tension or force here, then it should relieve some tension or force on the next link in the chain. So when we're assessing work environments and various tasks, I wonder about adjusting our thinking to be a little more holistic and take into account the next link in the chain. So we already know overhead work tasks can lead to lumbar lordosis and anterior pelvic tilt. However, in the case of overhead work environments, we often only consider the shoulder. And I'm hoping that the research helped demonstrate that what's happening at the hips is also important for the spine when it comes to overhead working postures. While eliminating this type of work would be the ideal solution, it's not always the most feasible or practical. And given the ubiquity of these postures in so many work environments, perhaps the best we can do is find strategies to prevent or limit the pain they cause. Incorporating this way of thinking and some targeted intervention may be a useful approach to other MSK problems in the workplace. So throughout this whole process, I did quite a bit of research going through the websites, and I just really like this this slide on why implement strategies prevent musculoskeletal disorders, and really because it's the right thing to do. And preventing pain and disability isn't just good for business; it's good for the person outside of work, and it's good for the healthcare system and society in general. So, quick summary and recap. Results of the study demonstrate the impact of stretching intervention to impact the lumbar spine during overhead work tasks. Targeted stretching intervention is a useful tool, and several factors to keep in mind if implementing one include time, compliance, and effectiveness. To be used in conjunction with other tools or interventions, and don't be constrained in the assessment tool structures. Consider the kinetic chain and how the body is connected. And again, I would be interested to hear what has worked for everyone else and what suggestions you may have. So please feel free to reach out. Email address is right there, and we'll be showing again later on. And one last thing before I wrap up, I want to share a quick anecdote from the research, and I didn't know where to put it in, so it went in here. So I was giving an example of how or when to incorporate stretching in your daily lives to, increase compliance for the month. I suggested that they could do it while brushing their teeth. So when one person came back for the second visit and I asked how it was, the response that I got was, at least my teeth are whiter. So even if the research didn't go as planned, there were some unintended benefits to all. So therefore, I did kind of wonder, can I also conclude that hip stretching not only impacts the spine in overhead work tasks, but also whitens your teeth? And with that, I'd like to thank my co-researchers, supervisor, Dr. Jack Callahan, and Dr. Janessa Drake at York University for the generous use of our lab, and of course, the participants in the study, the various lab mates and collection assistants, and CRE-MSD who helped make this happen. So thanks very much.
Thanks so much, Graham. We've got some really great questions, so I'm going to jump right to them. Would there be a similar observation with the lumbar angle if the sanding task was on the ceiling versus the walls?
I would, I mean, it might be more exaggerated. The further up you move your arms, or you raise your arms above that, I mean, these were close to 130 degrees. The higher up you go, the more pull you're going to have to rotate the upper body and increase lumbar lordosis. So I think you'd still get the same effect of a reduction. You might still see more lumbar lordosis angle magnitude, but I think you'd still see the reduction when you're affecting the hips, because you're only getting, again, from that one image, you're only getting the pull from one direction as opposed to pull from both directions. And if you think about it like two strings, if one's really tight and you're pulling on the other one, then it's getting like kind of that double effect of pulling it forward. I think by loosening up the hip flexors and the psoas muscle, you allow for there to be a little bit more pliability within that range of motion. That's a great question.
And I have one other question on the sanding. This is about a repetitive task. Like, is there something about push and pull while extended?
I mean, they'll have a different impact for sure. This one had a little bit of pushing in it. You're going to engage different muscles when you're doing this. So some of that would come down to some of the stabilizer muscles around that are also going to be engaged in it and your core stability there. So I do think, I really do think like allowing there to be a little more flexibility from the hip down provides the opportunity for there to be a little more adaptation when it comes to overhead work. So regardless of pushing and pulling, you could still, I mean, we didn't really change we changed the muscle structure, but it can still engage and support and provide that supportive and stabilizing mechanism at the hips still. So I think you'd still see a little difference. I think if you're pulling, you're probably going to get more lordosis than when you're pulling, because when you're pushing, you're going to engage more actively in trunk flexors, like your core, as opposed to pulling. You're going to be arching your back regardless to achieve the desired movement and task. Does that answer the question at all?
Yes, I think you did. Do the needed stretches change when the overhead movements involve weights, such as tools or, say, a hanging basket?
Sorry, can you repeat that one more time? Does the
need for stretching change when your overhead movements involve weights? For example, a hanging basket might be heavy, or tools that you're using.
I try to look at it as kind of the position that the spine is being put in. So I think it would have a benefit for both. If you, I mean, I think it would reduce the injury both, because you can allow yourself to be in that more neutral upright posture is kind of the main thing. So whether you're loading it, if you're loading it more and you have greater lordosis, you're applying that much more stress on the spine. Whereas if you can relieve some of that and keep it more upright while you're loading, then you're allowing it to load kind of more naturally and more normally as it should be. But I still think you get the same benefits. Like most things, you wouldn't want to overdo something. Like once you've reached a normal and healthy range of motion, kind of for all joints in the body, then really it's just maintaining that. I think the big thing here is we just see a lot of people with tight hip flexors. A lot of it has to do, I think, with our daily activities and kind of the sedentary nature of everything. So really, this is kind of getting people back to the point of sort of where we should be to see the benefits and just for like healthy movement overall.
Thanks, Graham. And I have a question here, and it's because I'm just starting to work out again, and I'm just wondering, You know, the fitness instructor there said, you know, make sure you change it up. If you're coming in today to work on your lower body, make sure tomorrow you work on your upper body. Does the same kind of guidance work for stretching? Should we be changing our stretching routine from one day to the next, or does it really matter?
I think that's a great question. I assume a lot of it, if you're doing more strength related stuff, also good on you. You're more active than I am these days, so I need to take a page out of the book. But working out typically, you know, you're kind of requested and directed to take some time off for the muscles to repair. Stretching, I did notice a difference just from a previous study that if you don't if you stretch 3 or more times a week, it showed us there was a difference between 2 or fewer. So frequency does matter, but like with anything, variety is important. Like the way I kind of look at it is like we just want to balance out the joints so that we're moving in a healthy manner. I think the reason why I focused on stretching was because they're not really in any stretching programs that I could find beforehand, at least when I was writing up the proposals. Um, I had experience for so long not knowing about it, and it seemed to be overlooked quite a bit. And then just where the population is sort of sitting, as I say, I was researching before, and it was the average. You know, tight hips were considered 180 degrees back in previous literature, like 20 years ago. But when I did just a population study of hundreds of people, the average was already below 180. So we were at 178, and then I picked the people that were even kind of more inflexible. So getting back to that, I think just getting back to neutral. So I recommend stretching kind of all areas. Like I think it's important to balance out what you've been doing and where you're at. And once you reach that kind of neutral state where things are back to where they should be, I think, then just as a balancing everything, more of just a maintenance is the most important thing at that point. You wouldn't need to overdo it in one area, just like um, you know like physio, you're trying to get back to a certain point. So this is the same idea of like, well, you just want to balance out what you've been doing for the rest of time and get yourself back into what should be like a more normal working posture. So is there a limit? Yep, probably. Um, Either way, it takes time for the muscles to adapt. So if you go every day, all the time, over and over and over again, you're going to see more of an impact. But I think the main thing is like don't be too infrequent so you don't get any change. Because if you are trying to get yourself to a different, biomechanical state, let's say, then it does require time, does require work, but the body takes time to adapt to both directions, kind of thing.
Thanks, Graham. So I'll be consistent. And I'd like to wrap up with a comment from one of our participants. Great presentation, Graham. This research area may have a great role for participatory ergonomics education, train the trainer, and involving workers to train colleagues under the direction of an ergonomist or a physio or an OT when it comes to adherence to and compliance with the stretching protocol on work sites. So Graham, thank you very much. Thank you to all of our participants today. And in closing, just a reminder to check out our MSD prevention guideline website and watch the CRE-MSD site for new events and upcoming resources. Thank you all and have a great week.